bila orang kena kanser ni, dia ada dua komponen yang penting, iaitu komponen genetik dan komponen environment. So you may be exposed with a lot of environmental factor tapi tak pernah kena kanser. Kita dengar kan, orang pakcik tu merokok sampai umur 70 tak ada kanser pun. So maybe environmental factor dia besar tetapi genetic komponen dia tak ada. So dia terlindung in that sense. Dan kita ni berketurunan, kita lahirkan daripada keturunan asal awal-awal ke bawah. So studies have shown memang our genetic make-up is not the same as it was 500, 1000 years ago. There's a lot of degradation, there's a lot of repeat genome dah yang menyebabkan kita mudah untuk mendapatkan kanser.
Okay, Assalamualaikum. Selamat datang Dr Ammar. Dr Ammar. So dalam podcast hari ni, mungkin kita tak tahu kot, ramai orang tak tahu apa tu Dr Pakar Paliatif. Selalu kita dengar Dr Kanser kan. So tapi Dr Ammar ni adalah Dr Pakar Perubatan dan dia sambung belajar lagi, dia sambung dalam palliative care. So palliative care ni kita boleh kata sebahagian daripada rawatan daripada pesakit-pesakit yang mempunyai penyakit kanser ni lah. Tapi sebelum kita go through dengan Dr Ammar ni, saya nak share sikit lah statistik dekat Malaysia ni. Kita tengok cases of cancer dekat Malaysia ni, kita tengok makin meningkat lah. Kalau tengok 2020 Dr Ammar, lebih kurang 48,000 48,000 new cases of cancer didiagnose. Dan based on statistik, they expected by 2040 the number is expected to double. So mungkin by 2040 case kita dekat 100,000 setahun. So mungkin Dr Ammar boleh introduce yourself sikit dan cerita sikit palliative care ni, apa skop dia, apa beza dia dengan doktor kanser ataupun onkologi ni.
Assalamualaikum warahmatullahi wabarakatuh. Nama saya Ammar. Saya selalu introduce diri saya sebagai bapa anak 7. Itu saya selalu introduce saya lah. So mainly a family man, tapi yalah kita belajar bidang kita ni. Betul, Sani kata cancer is actually on the rise. One of the reason kenapa cancer is on the rise is actually because we are looking for it better, we are diagnosing it better, and people are more aware, people coming forward with symptom better. So that's why the expected number tu akan rise, but we are detecting more. And there is a lot of treatment for cancer, which is good. Cumanya bidang saya ni bukan bidang cancer, tapi bidang saya ni banyak handle pesakit cancer. So jadinya onkologi, bahagian cancer, onkologi itself, itu bidang wife saya. Dia menguruskan solid organ cancer. So solid organ ni maksudnya any cancer yang bukan darah. So there's another bidang, nama dia hematology, bidang bahagian darah lah, hematology. So dia yang handlekan blood related cancer, termasuk lymphoma, leukemia, apa semua tu. So other than that, solid organ dia akan masuk bawah onkologi. So agak luas juga bidang tu. People are getting better at diagnosing colon cancer, lung cancer, breast cancer, and they're doing quite good lah. Treatment, everything is actually doing quite good. But nature of cancer itself, over time, bila orang kena cancer ni, dia ada dua komponen yang penting, iaitu komponen genetik dan komponen environment. So you may be exposed with a lot of environmental factor tapi tak pernah kena cancer. Kita dengar kan, orang pakcik tu merokok sampai umur 70 tak ada kanser pun. So maybe environmental factor dia besar tetapi genetic komponen dia tak ada. So dia terlindung in that sense. Dan kita ni berketurunan, kita lahirkan daripada keturunan asal awal-awal ke bawah. So studies have shown memang our genetic make-up is not the same as it was 500, 1000 years ago. There's a lot of degradation, there's a lot of repeat genome dah yang menyebabkan kita mudah untuk mendapatkan kanser keturunan terkemudian ni lah. So environmental factor plus genetic factor memang akan menyebabkan orang tu prone dapat kanser. That's why it's becoming more rampant sekarang. Betul. So with cancer, even though you got treated early, everything semua tu, so genetically you might have it. So eventually down the line, apa yang kita risau adalah recurrence of the cancer. Cancer tu datang balik. Dan semua pesakit kanser akan tahu hakikat ni. Even rawatan untuk kanser pun, some countries where they are quite advanced, dia rawat awal dan patient with cancer survive long, 20-30 years down the line, they are getting cancers because of the treatment. And ini tak dapat dinafikan lah, rawatan kanser to itself may cause cancer down the line. So macam kalau you umur 60, you dapat rawatan kanser, you may get another cancer when you're 100, which is probably not that important lah. But if you're in your 20s, you dapat rawatan untuk cancer, and then you're in your 40s, you're probably going to treat secondary cancer lah. And with that treatment pun, another 20 years, 60, 70, tertiary cancer. That is what's happening in the Western world nowadays lah, because they're picking up more cancer, they're treating more aggressively. So complication of the treatment tu lebih nyata lah, macam rawatan ubat darah tinggi, rawatan kecil manis kan ada komplikasi dia, sama je lah rawatan kanser pun ada jugalah. Palliative care, WHO ada definition dia, basically it's a whole person care where the aim of palliative care has nothing to do with cancer actually. It's an alleviation of suffering for patient and their families within resources lah, with whatever resource yang ada lah. So palliative care ni dia ada, generally we practice 4 domain dia, 4 bahagian manusia ni kita cuba uruskan. There's a physical domain which is sakit, lelah, mengah, apa semua tu. There's a psychosocial domain yang pesakit, kalau dia cikgu, dia nak kerja balik cikgu, atau dia doktor nak kerja balik doktor, dan tapi dengan penyakit dia tu macam mana nak kita uruskan. There's the emotional domain. Emotion, kita manusia memang kita ada emotion, ada marah lah, penyakit, marah lah, resah lah, frust lah, sedih lah. So the emotion domain we try to help juga. And there's a spiritual domain. So kita kat negara Malaysia ni, a lot of people believe that spiritual domain is pasal agama. Actually it's not. Religiosity is part of spirituality. Ada orang dia tak ada agama tapi dia masih ada spirituality. Dalam Islam, kepercayaan kepada ketuhanan lah, there is a bigger force. There's a bigger force in the world. Walaupun they don't believe in God, they believe there is a bigger force. Okay, so this is the 4 domains that palliative care do, and what we do is actually we alleviate suffering by going through all these 4 domains for the patient and family. Itu yang pasal palliative care. So palliative care banyak disangkutkan dengan onkologi, dengan kanser sebab yes, betul, a lot of our patient ada cancer, eventually bila masuk ke stage 4 ni, okay, orang kata rujuk ke palliative care lah. Okay, but what we try to do actually, kita masa dapat tahu tu itself, tak kira stage 1 ke stage unstageable ke, ada orang saya tak nak siasat, saya tak tahu saya stage apa, saya tahu mungkin ada cancer, saya tak nak siasat. We also take those kind of people because what we do is elevation of suffering. So contohnya, ada makcik umur 65, anak 3, anak dah besar jadi pensyarah semua. Tapi makcik ni dia dah hidup dengan suami dia I don't know 40-50 years, dan suami dia baru meninggal 6 bulan lepas. Okay, so bila tengok ada lump dekat breast dia, dia kata that's it. Dia pun, makcik ni maybe kerja cikgu ke, kerja engineer ke, dia educated person. They found a lump in the breast and she said no, saya tak nak siasat. Okay, so doktor akan, biasalah doktor bedah, doktor bayan, biasa tak ada phone call lagi lah, doktor bedah semua akan push, makcik kena buat, kena siasat. I don't want. So anak dia semua successful, mak kena. So makcik ni stress. Makcik ni stress lah. Anak dia marah kat dia, doktor marah kat dia, kena siasat pun ni, kena boleh buat something. Breast cancer is actually quite manageable lah kan. Tapi she lost her husband 6 months ago. So kalau orang duk push kena siasat, yelah makcik tu dah lagi stres, dia lagi tak nak dengarnya, dia mengamuk lah, buat macam-macam ragam lah. So if the service general surgery tu contohnya dapat refer ke palliative care, what we do is actually we sit down and talk to her. We try to assess from the 4 quadrant tu, the physical, psychosocial, emotional and the spiritual, what is causing her distress. So in her case, maybe she's having emotional distress, lost her husband 6 months ago. Maybe she's having psychosocial distress, anak semua successful, she's living alone, and husband partner dia 6 months ago dah tak ada. We try to alleviate that problem. Spiritual, maybe dia tengah menyalahkan Tuhan, kenapa ambil suami dia awal, padahal suami dia sihat je, maybe something like that. And maybe she has pain from the breast ke apa ke, from whatever back pain ke apa ke, yang tak di-address lagi, menyebabkan dia tak nak fikir dengan elok. So we try to assess the person, and then alleviate apa-apa kita boleh. Then sometimes bila kita borak-borak makcik tu, okay, sebenarnya saya tengah sedih dengan suami saya, bagilah saya masa 2-3 bulan nak cerita tentang sedihnya. Anak-anak saya ni saya cerita pasal ayah dia meninggal ni, dia orang duk berebut harta ni apa semua, all this can come up. We try to help with this, and then eventually patient tu, okay, sebenarnya saya nak rawat, saya tahu ni mungkin kanser, saya nak rawat tapi serabut dengan benda lain. So if this kind of person initially was referred to palliative care, we got to alleviate what is causing her suffering, and then she now agrees for treatment, go ahead, buat investigation, buat siasatan. Kalau sesuai buat pembedahan apa semua tu, we will support her along the way, and if she's no longer have a life-limiting illness, then we discharge her. So that's what palliative care do. Tapi secara realitinya, what we normally get is stage 4 cancer, tak boleh buat apa-apa dah, refer palliative care. Kalau yang pesakit okay lagi, we usually the journey with the patient for 6 months, a few years sometimes, but usually generally when people refer to palliative care, they have 6 months to 1 year prognosis estimated, and then they refer to palliative care, and we try to manage them lah, uruskan pesakit ni. Yang kita orang agak sedih je lah, banyaknya daripada pakar perubatan, daripada pembedahan, nazak baru rujuk, so kita orang tempat 2-3 hari je jumpa, kurangkan sakit sikit dengan ubat kita orang, end of story. So what we do also as well afterwards, because pesakit mungkin dah meninggal, so what you do actually bereavement lah, tapi bereavement I have to admit lah, it's not that well done at the moment in Malaysia. We look after, like I said, palliative care, we alleviate suffering for the patient and family. So after patient pass away, the bereavement of the family, we also took into context juga lah. We call up that, how you doing, how you handling, because there's such a thing as a complicated grieving, which can cause effect to the person health lah. So that's what palliative care is. So dia tak semestinya kanser sahaja, dia boleh penyakit jantung, penyakit buah pinggang dah banyak dah sekarang ni yang decided not to go for dialysis, everything semua. So we take those patient in. That is generally what palliative care do lah. We don't deal with death sahaja, we deal with managing a person if they have a life-limiting illness, penyakit yang tak boleh sembuh, and the prognosis usually 6 months to 1 year. We tend to handle that. But if for some reason their disease boleh di-cure, boleh di-investigate, it's okay, we can go through them along the journey and we discharge them. That's generally what palliative care.
Tapi I think that is quite a misconception regarding palliative care lah. Even I think most doctors pun think that, like what you said just now, bila end of care, meaning like we got nothing else to help the patient with, okay, refer palliative care, you take over from there kan, dah tak ada benda nak buat dah kan, so you take over lah. But I think this is a really good, kita kata eye-opening lah, bila Dr. Ammar cakap actually palliative care pun not necessarily for terminal ill patients only, but even those with end stage kidney failures and even heart attacks. Palliative care, I think what we understand as an outsider yang bukan dalam department you is when we refer to palliative care is more lebih kepada untuk kurangkan sakit patient, systemic punya pain kan. I think that is what generally, if you ask anyone what does palliative care do,